Welcome back to Studio 701. Many families had no idea what they'd be facing in 2020.
And many women are living with the extra challenge of being pregnant while in a pandemic. In today's Coping with COVID, we talk with Dr. Rhonda Schaefer-McLean. Thank you so much for being here.
Absolutely.
Well, first of all, just tell us how life has been different. You see a lot of patients, a lot of pregnant women. How different has it been this year compared to years past?
You know, it's incredibly different. We started out the year fairly normal in January, and by February 15th, we were changing everything and going online. For about 3.5 months, I saw about 20 patients per day virtually. And so that was really a challenge to kind of get on top of that. How do we do that? We didn't have a system for that before. And do we feel confident we were actually seeing patients, if you will? Were we taking care of them? Getting used to being more in touch with our organizing bodies, not just locally, but nationally, to see what's right, what's wrong. It was a lot of logistical adjust for all of us.
Yeah, and especially if information is changing as it has been, but especially seeing, moms, expectant moms virtually when, there's kind of a peace of mind with seeing your doctor in person and having them check that heartbeat and all of that stuff. I mean, there's got to be some extra challenges with that.
There were. I think a couple of things came out of it. We recalled how much importance there is to the feel of medicine, if you will. You want to be cared for. You want to know, in medicine we call it laying your hands on the patient, and then that way that kind of, healing, caring, assessing, and to just immediately be kind of jerked from that ability to do that was really, really significant for most of us. And I think, the other part of it that we learned is there's a lot of medicine we can do by just talking to our patients. It isn't about just coming in and just doing the exam. On the flip side, there's a lot to be learned. There's a lot to gather from your patient when you just talk and ask. And so I think the whole concept was just very, very, very educational, but definitely something new to get used to.
Yeah, it puts it all in perspective for us. But like you said, thank goodness for technology right now.
I don't know what we would have done, honestly, 15, 20 years ago. I just don't know how we would have sort of managed. I mean, I guess we would have used the phone and done the best that we could, but so grateful for all the virtual technology, so grateful for all the people who kind of stepped up and helped us do things that were really outside of our wheelhouse.
Right. I know you can have a lot of anxiety when you are pregnant or expecting. Add on to that the pandemic. What have you seen for that, as far as an increase in that with your patients?
Sure. I think women are amazing. We're resilient. We're fantastic. We have the ability to just kind of adjust and get where we need to be. And I see women listening to their bodies. I feel pretty okay. I like it when my doc tells me that that's okay too, but I feel good. And so I think overall women have been strong, and they've been the moms that they're supposed to be. But I think, We've had to grapple with the information as it comes down, because there was none in the beginning. I mean, if you think about it, first cases of COVID were happening in December in China. And so, a pregnancy takes 9 to 10 months, depending upon kind of how you count where the start is. And so for us to see that transition, and for patients to want information, we just didn't have it. We still don't really have it. We have information from women who got pregnant in December, and 9 months later from that is September now. And those women were, half a world away in China, and they have a very different ethnic heritage and genetics sometimes. And so there are a lot of things that we don't even yet know how to apply, even if we had access to all the data, and we don't even have access. So I don't think as docs we love the kind of waiting to see how things develop, but that's really a lot of where we are. So we're giving the recommendations that we have, but trying not to overstep, with things we don't know for certain yet.
Right. And speaking of recommendations, what advice do you have for pregnant women right now?
Sure. Typical advice, we say just really, really try to be well, be healthy, stay, in the best shape that you can be in. We want you walking. We want you taking your prenatal vitamins. We want you to wear a mask. That's a really important thing that has to happen. It's just as important for pregnant women as it is for anybody else. And then just minimize any unnecessary risk. What do we have that we don't have to do? Do we need to go go to weddings of 500 folks while we're pregnant? Maybe not. I mean, it's a really great, important thing in someone's life, but maybe be careful.
Be careful. Great tips right there. Thank you so much, Dr. Rhonda Schaefer-McLean. This has been Coping with COVID. And if you would like to talk to Dr. Schaefer-McLean directly, contact her at balanceND.com or Center for Family Medicine at cfmbismarck.und.edu. All right, keep it here. Coming up